Drug addiction is quite a common phenomena in even the well-developed societies and even the underdeveloped societies. So there are the different ranges of drugs that we usually come across depending upon their different categories that we've already discussed. In the class A, we have the psychoactive drugs, for example, the ecstasy, the LSDs that are usually regarded as the party drugs. And then we have the class B, which is basically a combination of the pharmacotherapy or the pharmaceutically active drugs as well as the psychoactive drugs. And then we have a grade C, in which group C, in which we have the usually prescribed drugs, and these drugs basically comprise of the drugs that are usually prescribed by the psychiatrists themselves. For example, the benzodiazepines, the hypnotics, or the antidepressant drugs. So we have to keep in our mind that the person can develop these drug addiction by himself, or it can be even by the doctor who has prescribed him those particular kind of drugs, and he's gotten used to that drugs. Tolerance has basically been developed, and to get to that particular kind of state, he uses those drugs more frequently, and he increases the dosages according to his levels, and that is basically going to fall into the category of addiction, because whenever he basically withdraws with those drugs, he's going to develop those withdrawal symptoms that are quite evident in that particular person over here. We're going to talk about the drug addiction in this section. The drugs or substances will be discussed in this section. What are the different variety of drugs that can be misused by that particular person? Then the harmful use or the addiction will also be discussed over here. Whenever we talk about drug addiction, we have to talk about, or we have to discuss the hazardous effects of these addiction criteria on that particular person. The dependence syndrome is basically, it can be defined as the withdrawal syndrome as well. When we talk about the withdrawal syndrome, it basically develops because of the fact that the person develops that tolerance to that particular kind of drug, and when he withdraws that drug, he's going to develop the psychological symptoms, and he's also going to develop the physical symptoms as well. So the presentations can include convulsions, it can include different states of the consciousness. The person will feel palpitations, the CVS can be involved, as well as the respiratory system can be involved at this stage. The drugs that we have to cover are the illicit or the illegal drugs. Now, when we talk about this legal drugs, it basically includes the tobacco and the alcohol. So a lot of societies, they basically accept smoking or the alcohol consumption as socially acceptable, and that is the cause of the increasing addiction to these drugs as well. So the illicit substances will be kept in mind, and the examples can be the CNS depressants over here. We can also include the benzodiazepines as well as the hypnotics and the CNS stimulants. For example, cocaine has to be kept in mind, and then cannabis is one of the drugs. LSD is basically the lysergic acid diethylamide. So it's one of the drugs, and ecstasy, it's basically all of these drugs. We have to keep in mind whenever we are talking about the drug abuse. So the magic mushrooms or the cat is basically one of the drugs or substances that we have to keep in our mind. The street or the non-compliant use, and the over-counter drugs. Over the counter, they're available if you have a prescription at your hand. In a lot of states, the benzodiazepines are available over the counter, polypharmacy or polydrug misuse. So whenever we are basically using different combinations of drugs, if a person is prescribed with those drugs can have a reaction on that particular person, and he gets addicted to them. So that is basically the use of combination of substances can again be one of the cause over here. The harmful use is basically the DSM-V criteria. We have to keep this in our mind, and the mild to severe range is what we have to keep in our mind. Severe misuse is linked to its psychological as well as physical problems, and obviously if a person is affected, the whole society is affected. So the social problems also arise with it. So basically, a person who is addicted is not morally at a very good level. He is demoralized, and all the demoralized values will gain an increase in the frequency. For example, stealing or all of these phenomena will increase in their incidences over here. The different criterias we can use. The criterias can be the compulsion or the craving. Whenever we are going to categorize the severity of the addiction, the craving has to be kept in mind. Then the compulsion, how strong is the compulsion? That is basically going to assess if that particular person is going to perform any act, for example, stealing or burglary, etc. So the tolerance has to be kept in mind over here, needing more to get the same effect, difficulties in controlling the use of the substances, and then we have to keep in our mind the withdrawal symptoms as well. When the substance use is reduced or it is also stopped in some instances, the relief of the withdrawal by the substance use is also kept in mind, and then we also take into account the persistent use and despite the evidence of the harmful consequences, the neglect of the interest and increased amount of the time to obtain the substances. The harmful use, whenever we talk about or whenever we consider the harmful effects of a particular drug on that person, the pattern of the psychoactive substance use and the routes of administration are also kept along, and they are thought together whenever we are focusing on that particular case. The mental or physical damage, then the diagnosis, the damage to the mental or the physical health, and then the harmful patterns of the use often criticized by the others. There are adverse social consequences as well, and the acute intoxication is sometimes not sufficient in its evidence as well. So the dependence syndrome is a definitive diagnosis of dependence is when there's a strong desire to take that substance. There are difficulties in controlling the substance taking behavior. The physiological withdrawal state is present. The evidence of tolerance is there. The progressive neglect of alternative pliers. And there is a persistence with the substance use. The evidence of overly harmful consequences is also present in that particular person. The criteria for substance use disorder in DSM-V, there is a problematic pattern of the use of the intoxicating substances, and the severity of the disorder is basically from mild, moderate to severe. And then the substance is often taken in large amounts or over a longer period than was injected. Persistent desire to take that drug. The great deal of time is spent in the activities necessary to obtain these substances, and the craving or strong desire or urge to use these substances. Then the recurrent substance use in situations in which it is physically hazardous even for that person, but still he thinks that he has to take that drug and he has that compulsion to take that drug as well. The withdrawal is manifested as a characteristic withdrawal syndrome depending upon the substance that he is taking, and the substance or a closely related substance is taken to relieve that withdrawal syndrome. The tolerance is basically when the need for markedly increased amounts of the substance is to achieve to desired effect, and the markedly diminished effect with continued use of the same amount. So it's basically due to the continued use of that drug that the person develops that particular kind of tolerance. So in this section, basically, we focused on the fact and the different signs and symptoms when the person, we're going to label that person, he is a drug addict. So that is the end of this section. Thank you for watching sqadia.com.